So today here in New York State, we just lost a whole bunch of nurses and a whole bunch of other people that work in the hospital. And why? Because of the vaccine mandate. The vaccine mandate kicked in, and now people are losing their jobs. And does this make any sense to anybody? Well, I know that there are people that think that healthcare providers are supposed to be aware of the science and they're supposed to be on board with the vaccine. And you know what? Probably a lot of us are. So I've been a healthcare provider. I've been a nurse practitioner for 25 years. I'm vaccinated. I've just had a booster shot. I'm definitely not anti-vax. But on the same token, I understand those people who don't want to get vaccinated for whatever reason. And I think that as soon as this became a mandate and you started telling people that they had to get vaccinated, that's when the resistance really started. And I think this was a big mistake. And I think time will probably tell that if we hadn't done a mandate, probably more people would have been down for getting the vaccine. But in any case, we're losing a bunch of nurses. The hospital that I work at, we're down 400 nurses right now. And that is before we lose the nurses that we're going to lose today. And we're not just losing nurses, we're losing lab techs. And this affects everything within the hospital. It's going to affect the time that you spend in the emergency department waiting room. It affects everything. And it's just a shame. And here's the other point that I want to make is that I am, all right, I'm a PhD. That doesn't mean that I'm a hard scientist. I'm not a cosmologist or anything like that, but I do understand research. And I believe that it's my duty as a PhD to be skeptical and to have some humility and to say sometimes, you know what, I don't know what the answer to this is. And I think at the very beginning, if people were honest, if the scientists were honest and said, you know what, this is novel, this is new, we really don't know what the answer is to this, but here's what we think might be the best approach. And then I think people would probably understand a little bit more why you're doing what you're doing. But there just seems to be just 100% total acceptance amongst a vast majority of the medical community, the physicians that I work with, and so many other people. They're just accepting what is being told. And let's face it, we've only known about this virus for a year and a half. We've only known about the vaccine for a year. How can you be so sure? I mean, it's possible that science could be absolutely right. And absolutely everything that people say from the CDC and the NIH might be absolutely correct. And then again, it may not. And that's where true science kicks in. So when I see people say, well, follow the science, let's face it, the science will not be borne out for a decade or more, not only on the COVID virus, but also on the vaccine. And that is what bothers me more than anything. We need to be humble and we need to admit that we don't know. And I think that it's a mistake to fire healthcare providers, particularly at this stage. You know, we've had mandates to get flu shots at my hospital, and there's always been an option. If you didn't want to get a flu shot, you didn't have to get a flu shot. You could just wear a mask. And that's what a lot of people did. They just elected for whatever reason to wear a mask and not be forced to get a flu shot. I don't think anybody ever had a problem with that. I'm going to say one more thing. I was practicing in 2008 during the H1N1 pandemic, and that was a pandemic. And, you know, I couldn't even tell you right now how many people are reported to have died from that pandemic, but it's not a small number. But did we ever wear masks? No, never. I mean, I was working in an emergency department and an urgent care, and I was seeing positive flus all the time. And I would, you know, test them, and then I'd go to their bedside and say, hey, by the way, you got the flu. And, you know, these people were sick, no question about it. But did I worry? I mean, was I wearing a mask? No. Were they wearing a mask? No. Were restaurants locked down? No. None of that was going on. Now, I understand COVID-19 is a different virus, And that's my point, is that we don't know much at all about this virus. And I think we need to be a little more humble and a little more careful, and certainly a little more skeptical as scientists, as physicians. And I think that's probably something that the public would understand. So that's all I need to say about that for right now. I'm sure that there's going to be more that I'm going to want to talk about later, but we'll start with that for now. So tell me what you think in the comments below. I want to know, am I alone in this? Am I the only one who feels this way? Or are there other people out there who believe that we just need to take a step back? We need to be a little bit more thoughtful and employ a little bit more critical thinking on the virus and our approach to the virus and our approach to the vaccine. Okay? Thanks for listening to me, and I'll talk to you soon.